patient lungs will function fine. So classically horizontal and oblique fissure here, and only one oblique fissure, and these fissures are sometimes very deep, they reach up to here, sometimes they are very superficial, so it varies from one person to other person. And again, impressions are not clear, but we understand the heart is related here, left side, right side is related here. So posteriorly this impression is for the aorta, okay, while here posteriorly this impression for the azygous vein. This is inferior vena cava impression, this is superior vena cava impression, and between is the heart impression, and this is the subclavian vessels impression here. So they are not again as much clear as we wanted to see. So you saw this, you saw this, you saw this, and then in this you see the ramification of the trachea here. Okay, right. This is the right lung, left lung. So on the right side we are having one principal bronchus, a right main bronchus. This is left main bronchus. Right is shorter and more in line with trachea. Left is longer and more horizontal. Okay, so you see, because heart is more projected on the left side, so the left principal bronchus is longer. Okay, on the right side there are three lobes, so this principal bronchus divides into three lobar bronchi: superior lobe bronchus, middle lobe bronchus, and inferior lobe bronchus. Correct?
Yes.
While on the left side, two lobes, so superior lobe bronchus and inferior lobe bronchus. Very easy. Then the tertiary divisions will occur, which will supply the bronchopulmonary segments. We have apical segment here, anterior segment here, and posterior. So the superior lobe bronchus will divide in apical bronchus, anterior bronchus, and posterior bronchus to supply apical bronchopulmonary segment, anterior bronchopulmonary segment, and posterior bronchopulmonary segment. In the middle lobe, it will divide into two, the medial and the lateral bronchopulmonary segments are there. So medial bronchus and a lateral bronchus. In the inferior lobe, it will divide into five. One is the superior, and then we are having four more: anterior basal, posterior basal, medial basal, and lateral basal. 1, 2, 3, 4. They have not shown all, so there is a mistake. Yeah, they have shown it at the back. This is superior. If this is superior, then this is anterior basal, posterior basal, medial basal, and lateral basal, something like that. So superior,
Yes.
anterior basal, posterior basal, superior, anterior basal, posterior basal, medial basal. Okay, they have done a problem here again. We need five, but it is 1, 2, 3, and 4.
Yeah.
So not correct here. Let us see on this side. 1, 2, 3, and 4. So again problem here. But there are 5, as I told you in the class. So these are made by technicians, so there is mistake in this model here. But definitely this is superior, then this is posterior, this is anterior, medial, lateral basal, anterior basal, posterior basal. So on this side it is correct, while here it is incorrect. Yeah. And here in the upper lobe, you are having the apico-posterior here, then superior, inferior, superior and inferior. Okay, apico-posterior, superior and inferior bronchopulmonary segments. Okay, but you should not go into detail of these because these models are having problems, so we will not put any question from these. Again, this gives you an impression of how the divisions are there. I think it appears good. 3 here, then 2 here, 1, 2, 3, 4, 5. This is correct. This is correct. Here 1, 2, 3, 4, 5, 6, 7, 8, 9. This is correct.
Yeah.
Okay. So this is about the mediastinum part of the lecture, and then you come here in the axilla. Okay. You see in the axilla.